Good morning, everyone.
Good morning.
So as we still have a few people joining on the phone, we have a few people still signing up in the here in Las Vegas. We'll just go ahead and again start with some of the ground rules. For those of you on the phone, if you could please remember to mute your line. If you need to disconnect from the call to do something else, please just disconnect and don't put us on hold. Also, if you are listening to us on the internet and on the phone and want to make a comment, if you'll want to mute your speakers on your computer when you talk, that will help reduce some of the feedback. Again, this is being broadcast over the internet. You're all welcome to at least tune in there and be able to listen to the conversation. And then if you have something you want to contribute, that's always welcome over the phone line if you're not here in either of the audiences. So again, my name is Marla McDade Williams. I'm the Deputy Administrator for the Division of Public and Behavioral Health. For those of us in the audience here in Las Vegas as well in Carson City, again, a reminder, if you could mute your phones as well, mute your cell phones so that they do not disrupt the testimony once we get going. So as indicated, I'm the Deputy Administrator of the Division of Public and Behavioral Health in the Department of Health and Human Services. We're the state agency charged with certifying medical marijuana establishments and overseeing and regulating as it relates to that work that we do. We do have a team of people working to develop the proposals that have been in front of you and that we will be moving forward out into the future. Up in Carson City, I have Joseph Thiele, who's our management analyst. He assists with logistics and research. I also have Kelly Bone with him, a master services agreement contractor performing needs assessment, including research and design of the operational program. Chad Westham is the bureau chief that will ultimately be overseeing the medical marijuana establishments, and he's not in the audience today. He's on travel with another part of his responsibilities. So before we get going with comment about the proposals we're discussing today, is there anyone that wants to make just general comments not related to our agenda today? In Carson City or here in Las Vegas? What I am going to do is I'm going to switch things up today. We will go ahead and take comment from the phone first, just so that we can be fair to everybody. We've taken comment first in each of the locations. So today we'll start with the phone. But let me go ahead and the document we're working from today will be primarily the medical marijuana establishment application evaluation process document. It's an 8-page, I think 8 or 9 pages, 9-page document that we sent out through the listserv. It is posted on the health division or on the division's website at health.nv.gov under the medical marijuana program links. We do have hard copies available in both audiences. And again, the purpose of this meeting is to allow an opportunity to see some of the proposed language for the regulations pursuant to Senate Bill 374 of the 2013 legislative session, and then to try to get everyone to provide quality input that we can use to continue to move forward in this process. Again, this is a forum for us to have dialogue, so you're welcome to come up, make your point, let others come up, make their point, and then after we've gone through all 3 locations, the phone, Las Vegas, and Carson City, you will have an opportunity to come back up. I'd ask you to please stick to today's agenda, which is to review the proposed concepts related to the application process. And then, so that will be the first part. And then the third part, or the last part, will be discussion and solicitation of recommended models and methods to implement financial tracking and oversight of medical marijuana establishments. As we get to next steps, I'd ask you to think about what we have not presented to you in any of the documents that we have prepared. And if you could talk to those items when we get to next steps. Again, just a reminder, you need to mute your phones here in the audience in Las Vegas and Carson City, as well as on the phone. And I do want to thank our callers on the phone yesterday. I think we're getting used to the rules and how we need to all interact with each other. If you could continue to be mindful of that, it really is appreciated by everybody. So as you speak, remember to identify yourself clearly and make sure that you've signed in, and if you're speaking on the phone, to send a follow-up email so that we can make sure we have accurate information for you. This meeting is recorded, and we do have, you are able to purchase copies of the recording through the Legislative Council Bureau's Publications Unit. And finally, as you know, we won't be debating the merits of the bill. That isn't our charge. Our charge as the state agency is to move forward the regulations to implement regulation of medical marijuana establishments. So do we have some general public testimony? Go ahead, please.
Yes, this is Las Vegas. My name is Kathy Gillespie, and I appreciate the opportunity to go back and do some general testimony and touch base. I would like everyone to keep in mind the primary object of this bill, and that is to supply affordable, legal, accessible medical cannabis to those patients in need. It's about the care.
Really stupid. I would say no.
On the phone, please. I'm sorry. Would you please mute your phone? Thank you.
Thank you. We want to do everything we can to keep the cost down so the medicine is affordable. We would like the state to support some type of discount programs to veterans and seniors. We've heard that testimony and some of the comments earlier. Again, in the line area of keeping costs down, there's some language right now requiring certified versus reviewed financials. And if you talk to a CPA, a certified financial statement for a $5 to $7 million business is probably going to cost somewhere around $30,000 to $40,000, where a reviewed financial could cost $10,000 to $20,000. And many of your banks, even SBA, requires reviewed financials, not certified. Keep in mind any of these additional costs that are placed on either the dispensary, the cultivator, the edible, or the lab are unfortunately just going to be passed on to the ultimate user. And the point of this is, again, to make, cannabis, medical cannabis, affordable. They've touched on packaging. I believe the packaging should be left for the dispensary, not the lab. You're going to overwhelm the lab, not the cultivator. The packaging is going to be part of the marketing, which is also going to be part of the dispensary. They're going to want their own identity. For state enforcement rules, you're going to need to have the name of the dispensary, their name, their address, their telephone number, their contact information, the batch, the lot number. This is all part of the packaging, so it should go with the dispensary. We do not support physicians owning dispensaries or cultivation houses. In our opinion, this is a direct conflict of interest, the same as physicians owning pharmacies. The hoarding or the spreading out of licenses, again, we need to keep the medical cannabis affordable. The hoarding of the licenses should not be allowed. 6 months to activate your license, possible extension of 3 months after that if you're unable to get your ducks in a row. And that should be from the date you get the license to your first sale. If 9 months goes by, then the state needs to look at a process of then reassigning that license to the next group in line. Our opinion, again, limit the number of licenses for groups and individuals, limit it to 2, maybe 2 dispensaries, maybe 2 cultivations, but we would prefer to see 1 dispensary, 1 cultivation, 1 dispensary, 1 edible, 1 cultivation, 1 edible, this type of thing, to spread it out and, again, keep any one group from gaining a foothold on this. We 100% support what the state has suggested in the seed to sale. Again, the medical cannabis will be as simple as Economics 101. It's going to be a supply and demand based model, which we support. Consulting physician, we do not support that. Again, we are trying to keep medical marijuana as affordable as possible. We heard the gentleman yesterday in Arizona where he said consulting physicians require $2,500 to $7,500 a month, and they've called them once. Again, this type of a cost is just going to be passed along to the end user. We are supporting a Walgreens/CVS/ Long's Drugstore, Albertson Smiths, whoever I'm forgetting, I apologize, a pharmaceutical model. They've been doing this for years. It's a safe model, it's a good model, it's an effective model, and we would like the law to support and follow that model. Panic buttons were brought up yesterday. Anyone that has a commercial alarm system already has a panic button in it. There's 2 panic buttons. One goes direct to your local police station. One goes to your fire station. We feel that all these units will need commercial alarm systems, camera systems. The panic button is part of that. We do not support any outdoor cultivation. Needs to be 100% secure, 100% guarded, needs to be 100% indoors. We support some type of a system or a merit-based system that supports our community and gives back to our community. Gives back to local agencies, the non-for-profits, local and statewide politicians, even government agencies and departments. The people coming in from the outside, like from Colorado, California, and Arizona, they have not given back to our community. They have not given back to the state of Nevada. Although outside companies cannot be prohibited from issued a license, Nevadans, especially those that have given back to the community through their time and money, should be supported and given a heavier weight when licensing begins. Their past history and track record of giving back supports the future of these same people and these same companies giving back to the community in the future. People and companies coming in from the outside have no track record for this. Since the licenses are being distributed on merit, we must ensure that the local groups and individuals that have the proven track record of giving back to the community are more heavily weighted than those that have no history of giving back. Also, the out-of-state companies and people bring in their own employees. They bring in their own growers. They bring in their own bud trimmers.
Gillespie,
Yes.
I don't want to discourage what you're saying, but I think you've made your point. If we
Okay.
could, do you have any other points you want to make this morning?
One more minute, maybe even 30 seconds.
Okay.
They bring in their own trimmers and the like. They will not employ local Nevadans. They will not employ as many local Nevadans as those of us who are given weight to being here local. And lastly, please keep in mind again the costs in addition of these regulations will just add to the costs of the facilities of the medical cannabis, and unfortunately those will just be passed along to the end user. Thank you.
Thank you. Well, we were just taking general public comment, so we hadn't moved into the agenda yet. So,
I thought you said you were taking telephone calls.
right, but again, that was general public comment. So if we don't have any other general public comment, then I would like to go to the phone.
No, we do have general comment. My name is Ed Alexander, and I want to touch on the electronic registry process that's been proposed. I believe we need to mirror something very similar to the state's smog requirements, in the sense that if all of these dispensaries or cultivation facilities are utilizing their own electronic registry, it's going to be impossible for a facility in Sparks to identify that a patient in Reno has already acquired their 14-day supply of cannabis. And
Mr. Alexander?
Yes.
If I don't want to, again, discourage, but the way that we envision at least the electronic verification working with the cardholders is every dispensary would have to come through our division. Once a patient comes in and makes a purchase, then they have to record it with us, and so there will be a verification process. It will be through the division. It won't be interdependent between each dispensary. So we will serve as the centralized verification system for purchases of patients. At the outset, we envision that that's probably going to be a manual process, but I believe within a year and a half, we will have an electronic verification system. We've put it out to bid. It's part of our centralized licensure system that the division was authorized to move forward with in the last legislative session. So before anybody gets too caught up in that, I just wanted to put that on the record.
Okay. The only other point that I wanted to address is hopefully there's been a lot of attention paid to the patient's rights as it relates to HIPAA and the confidentiality set forth. I'm not sure, the identification process from taking pictures of the patient or the caregiver making this transaction. I just want to make sure that we've done our due diligence in exploring the legality of that sort of documentation as it relates to patients' rights. I mean, I think once you've shown an identification card or swiped in, I'm not aware of many pharmacies that require your picture to be taken upon picking up your prescription. So I just want to make sure that we've explored the excesses of some of the regulatory wording. Thank you.
Thank you. Any other general public comment not related to today's agenda on the phone?
Yeah, hi, this is Cody Bass. I'm the founder and director of Tahoe Wellness Cooperative, which is actually only a mile from the Nevada state line. We've been operating for just over 4.5 years. We're licensed by the city of South Lake Tahoe. And I would urge you guys to, if you could, come at any time and look through our operation and see kind of how we've done things. One thing that I haven't seen the state of Nevada include in any of this process is a process for a true compassionate center that would be structured as a nonprofit entity. And I would urge you to look at what that could do for your local communities, as well as the patients within the state. And I think Tahoe Wellness is a great model to see that and what that can represent. As I completely support the for-profit model, and I commend the state for taking that stance, I do believe it would be to your advantage to look into allowing, some sort of process in this evaluation, part of the application process for applicants that are wanting to set up that business model that's related around a compassionate center, that's related around, being a not-for-profit center. And I think there's different ways that could be written into the bill to promote that, because I believe that having a few of those throughout the state would really be a benefit to the residents of Nevada as well as the patients, within the state.
Thank you, Mr. Boss. I guess I would say that probably is a topic that should be taken up by the subcommittee that was established by Senate Bill 374. And as we all know, that subcommittee portions of the membership can't be selected until we've actually certified some entities. But that is, the application process is being managed by the legislature. If you want to go onto the website, leg.state.nv.us, you can find the application process for that subcommittee, because we are not debating the merits of the bill and the nonprofit or for-profit status. That isn't our charge in this forum. But thank you. Anybody else on the phone?
Yes, thank you. This is Mark Terbeek, and I just have a couple of comments on the proposed application process that was published yesterday. One, I noticed that there was in the regulations that were published last week, there was a specific reference to a merit-based point system for medical marijuana establishments that recognized their employees joining a labor union. I would ask that the division consider making that a specific part of the draft application process, either under community impact or plan of business operation. Two, and this is a kind of a general concept with regard to the entire process, particularly on the cultivation end of it. This is a product. This cannabis, medical cannabis, is a product, and it's a medical product. And I understand the concerns of individuals who want to control costs, but the fact is at the production end of it, this is a medical product, and we don't want pharmaceuticals, which this is going to be mirrored after a pharmacy, these establishments. We don't want them, quote, controlling costs, unquote, at the expense of the best, safest, most effective medicine. And the fact is that from a production end of it, at the cultivation end of it, which is the wellspring of all of the material that will ultimately be consumed, that end of it particularly, we want to make sure that there is the highest and best practices available, especially specifically on product safety and efficacy through scientific bases and examination and testing, something that lets the public know that the medicine that they're consuming on a commercial level, and I'm talking about the commercial cultivation, not individuals cultivating for themselves, but the commercial. I think we need to really
please mute your line
on the application process as it really dials up the requirements for that, because we want to recognize that this is a product, and like any other product, it needs to be safe. And then third, the points system with respect to this, I would ask that the division consider having a lot more points to play with for analysis of these various components, and particularly weigh product safety and environmental safety concerns on a more heavy impact than it is. I mean, not all criteria are equal, and frankly, if I'm a consumer or an interested citizen, and I see two equally well-funded entities with great capitalization plans, but one, they're putting their capitalization into making the product safest and most environmentally sound, as well as non-diversion, and the other one may have great non-diversion program, but it's environmentally harmful, uses a lot of pesticides, and doesn't really present the safest, most efficacious medicine, then I would think that the process should much more heavily favor the former applicant rather than the latter applicant, even though the two are equally well capitalized. So these are just some of my comments. We really want to focus on this one, because here's what's going to happen if it's done wrong. You'll have some people out there wanting to do it the best practices, then you'll have other people there who will skate on some of these issues, and there's going to be an unfair competition, and what's going to get to the end consumer is less efficacious, less effective medicine that is more environmentally damaging and more costly to the community at large than the best medicine that would be provided by the better actor. And that's all I have to say on that. Thank you very much.
Mr. Trabik, if you can hold on, I have a question, but I would like to remind callers on the line that you do need to mute your line. If you do not know how to mute your line, if you could please disconnect until you can figure that out, we would appreciate it. There's just too much feedback coming over the line. You are able to listen on the internet. If you're just listening, please go to the internet if you can, if you're just listening and you don't intend to come in on the phone. So, Mr. Trabik, going back to the point system, you talked about labor being maybe a community impact in item E, I presume, And
Yes.
then you talked about product safety and environmental center being in item D3. Is that where you were referencing?
Let's see here, item D, let's see. Yes, that would be in the operating plan. I would think that that would be something that you'd put in the operating plan and then give specific points within the general operating plan points, and break that down so that there are specific additional points that really recognize those actors, particularly on the cultivation end of it. Because by the time it gets to the dispensary end of it, that product safety and the environmental impact has been addressed more or less, more probably rather than less, in the cultivation end of it. So that's what I agree. That's where it would be in the operating plan. And then the labor and employment and the community benefits plan. Because a well-paid, living wage, protected workforce is in and of itself a community benefit.
Okay, and so then your overall conclusion was that we should add more points to those categories to give more weight to those areas.
That's correct.
Okay, thank you very much.
You're
Next caller on the, I guess we have moved into the agenda for today. So the next caller on the phone, please.
Hi, this is Tony Chaskelson. I had a question from today and yesterday. We talked about cultivation facilities, dispensaries, but then we also talked about processing, and I'm not sure of the distinction between processing and cultivation.
Thank you. I'm sorry, I didn't get your last name. Could you spell it for us, please?
Chaskelson.
Thank you very much. So as the definition of medical marijuana establishment pursuant to the bill includes 4 different facility types: dispensary, a cultivator, the lab, and then what we're calling edibles, or in production or production of infused products. So when we say production, we're referencing the production of edibles or infused marijuana products.
So that was because people alluded to use the word processing, which sounded like it was different than cultivation, but that's really the production of the edibles. Is that correct?
I don't know that I'm able to.
It's distinct from cultivation.
Yes.
Okay, thank you very
Processing is distinct from cultivation.
Okay.
Anybody else on the phone that would like to address the evaluation process for applications? And I guess let me just give an overall summary. So as you can see, what the overall concept is that we open up a period of time.
I do have a question. Maybe I should know, but I don't. Reference is made on page 2 to proof of credentials from a certifying organization in organic production. Presumably that refers to the cultivation of the marijuana. Certifying organizations in organic production of marijuana are probably going to be hard to find since it is essentially illegal. And do you have some, I mean, it is basically illegal, although there are exceptions in certain states. Am I missing the point, or do you have some other meaning for that?
What we are not intending to do is say that you can only demonstrate organic production if you've been certified, for example, by the U.S. Department of Agriculture, because we recognize that the USDA is not going to come in and certify an illegal product. However, and we would look for you all to tell us, is there some certifying body that would certify to organic at all? And if there's not, then we have to consider whether or not that's any criteria that we can include. But oftentimes there are private sector certifying bodies that could come forward and meet some requirement. But if they're not available, then as you come through and give your testimony, if you just want to weigh in on that, we would just take that input at this point.
Thank you, ma'am.
This is Adam Mintz from Steep Hill Lab in California. I had concerns regarding on B2, the adequacy of educational plan. Obviously, the employees and the people running the dispensaries are not going to be able to give any sort of education to the patients without the role of the laboratories. That all of that information comes from testing of cannabinoids, testing of terpenes. Different cannabinoids have different effects on patients, some that may be desirable and some that might be undesirable. In addition, the same goes with terpenes. So I think it's important that the educational plan, that the dispensaries and cultivators work in conjunction with the laboratories so the labs can make sure that the appropriate data is given out to the employees of these dispensaries, and then in turn they can relay that data and information regarding cannabinoids, terpenoids, and so forth to the patients, because a number of these different cannabinoids affect many patients very differently, and it's very important from the patient point of view that they're getting the right medication possible. Thank you.
Mr. Mintz, how would the lab be able to intervene in that? I'm not understanding the connection. Mr. Mintz, are you still on the line?
Basically, the lab would be able to. So basically, when marijuana is tested, you can just for example, in SB 374 and also some implementation writing that's talked about testing for potency, testing for pesticides. But the point where we're at now in testing is we're not just testing for potency, we're testing for full profiles of cannabinoids that exist within each strain, each edible, each concentrate, and these different cannabinoids can have different effects on patients. Things like high THC is more psychoactive. Things that are high in CBD are less psychoactive and more appealing to patients who are looking for perhaps pain relief. Things that are high in THCV can provide anxiety, relief from anxiety. So I think it's important that the laboratories work in conjunction with dispensaries in the sense that they should be also on the forefront of educating the dispensary, because the dispensary is going to have to somehow learn about this data and what this data means to the end consumer.
Okay, thank you. So would it be, I guess then it's not really having the lab educate the employees, but it's the importance of what the lab finds in its testing process to be able to communicate that back to the dispensary about what it's finding in I guess the cultivator, right, of what it's finding in its product, and that the label be carried forward through the dispensary so that the end user patient and the agents, the employees of the dispensary, are able to articulate what the label means.
I would say that that's a great way to go about it. As long as everyone has access to the information and understands it, I think that's really the end goal. Yes.
Thank you very much. Next caller, please.
Hi, this is Rebecca Gasker. Good morning, on behalf of System Stigma. And I appreciate the comment that Mark made in terms of expanding the number of points. And something he said I wanted to respond to, and that was the weight of it. Because, of course, some sections have a higher weight than others. And I think that the expansion in each section of the number of points, not just perhaps a playing around with the weight of each section, but an expansion of points for each section would help the department in its discernment of those that really do rise to the top and those that fall below. I noted that the division does not have to certify, it says it's in page 8, the division is not required to issue the maximum number of medical marijuana establishment registration certificates as set forth in these regulations, which I appreciate because that means that, you know, some of those folks who may have met the very, very minimum requirements and have put in things with titles according to the evaluation process, but really don't exemplify a robust and responsible approach, they won't be certified. But what isn't in here is if there's a certain number of points that minimum threshold would be. And so I'm looking for a little clarification on that. And then I also appreciate the division's care in extending the opportunity to the general public to weigh in on the process itself. But I'm a little worried that the point at which the public is given the opportunity to weigh in is before businesses have actually been invited to apply. And what to me that means is that there will be a very limited amount of information out about these potential applicants, and that the public won't have, a real opportunity to provide feedback. And so I'm not sure if that point in the process is the most appropriate time to actually make that happen, if that makes sense, or allow that to happen. So that's just my general feedback, and I certainly will write you an email in order to explain this a little more thoroughly.
Thank you, Ms. Gaska. Before we go to the next caller, let me try again. So the process that we envision is first doing one read through where you ask for the request for qualifications and you set up some minimum standards or some minimum requirements for potential applicants. And then as you wade through those, then you get to the application process. Very clearly, we still have to work this through with the local governments. We referenced a letter of support, but I don't think that is an adequate way at this point to reference the support from the local government. And then as to the point that Ms. Gaska made on page 8, what we were simply trying to say with that statement is that as we rank applicants, and they will be scored, and you will have a certain number of applicants, and everybody is ranked, if we're only able to take one application in one geographic area, for example, for a dispensary, we have 5 applicants, it really only makes sense for us to move forward the first ranking applicant to process that application, and the other applicants ranked 2 through 5 who met the requirements, we won't process their application. So we were simply saying there is a point where you may have met the requirements, but your application will not be processed because we can't issue that number of dispensaries. So that was what that language was intended to do. But I do appreciate and I don't think we envisioned setting forth a minimum threshold. I think we envisioned that you would either meet the requirements or you wouldn't. But maybe we do need to consider a minimum threshold, and we look forward to your input on that. So, and as it relates to the general public weighing in, again, I think our concept was primarily the location of being able to post at a location and having your immediate neighbors weigh in on whether or not they were going to be supportive of that location, more so than, are you going to contribute a certain amount of, I'm going to use the wrong word, but, what is your contribution to the immediate society around you, the societal impacts and the societal benefit. Really, we were just looking for that location, that physical location, and are your neighbors going to be supportive, or are you constantly going to be battling your neighbors because they don't want you there, and it's an opportunity for them to tell you. So,
this is Paul Larson, if I can make comment. One of the requirements of Senate Bill 374 is that you come forward in the initial process with a zoning letter, for lack of a better term, from local government. The process you're describing now forces an applicant to go through that process twice, once at the zoning level with local government, and then once in the process you're talking about. It seems inappropriate to do that twice. And that's my first point. And the second point is I'm not sure you have the power, because that power is granted to local governments under NRS Chapter 278. So I was wondered how you want to address that particular point where you're putting an applicant through the ringer of public comment twice.
No, and I appreciate that comment, and I think we will just take it under an advisement. Very clearly, we still have a lot of detail to work through, particularly with local government, but we will just take your comment under advisement, and we don't intend, best case scenario, we won't have applicants going through a process twice, that we will be able to have a very complementary system. I just don't know if we're going to be able to get there. That's where we want to go. It's just a matter of how can we get there. As you know, just in Clark County, there are at least 5 different governments to deal with. So it's going to be very difficult, probably. There are going to be some where we're all going to agree and we're going to be able to work together, and there are going to be some where we're not. And there's just not going to be a lot that we can do. But we just want to be able to understand where the limits are for everybody as we move this forward.
This is Mark Trabik again. I'm sorry, I just want to address that point with this comment, in that the statute allows for provisional registrations on satisfaction of the state's process, and I would again suggest that the state have a manner of its approval process that allows the granting of a registration subject to not as a precondition of getting a local government approval, because some local governments may not have any process at all. They may just sit on their duffs and not move forward on it, and they can't ban it outright, so they'll just not move forward on it. So I would ask that the registration process allow for provisional registrations subject to further analysis on complying with a local process, but not dependent upon the local process if the local process doesn't exist. Thank you.
Thank you, Mr. Trabik. I think we definitely recognize that provisional process. I can tell you that it's going to be a difficult position for us to be in, to move someone forward into a provisional license and then have them 2 years later still be struggling, if that's the case. And I am in our other line of business, we have had situations where the local government has not weighed in on the zoning, so our applicant sits in this perpetual no man's land of not being a fully licensed entity, but yet still doing business, and then their competition gets upset. So it's a tough position to be in. There's a point where we are going to just simply have to declare we can't get the local government to move forward, therefore we're going to deny. And it is what it is if we get to that point. But
this is Paul Larson again. I think SB 374 is very clear on that point. One of the prerequisites for an application is that you have to have both a local license and a local zoning approval. If the local government's not going to provide that, then you don't have the requisites for the license. So I don't think you're in a position to second-guess that decision at the local level.
Mr. Larson, I would love to be able to agree with you, but the law says that the state has to approve or deny an application within 90 days. And
that's exactly my point. If somebody doesn't...
It does allow for the provisional license, though. And that the law does allow for the provisional status. So
I'm not arguing that point.
What I'm
pointing out to you is the statute specifically requires as a prerequisite for application that you have those local government approvals, both a business license and zoning approval. If you don't have those, then you don't have the requisites for the application to you. Therefore, the application to be complete, you couldn't process it. And that's in the statute itself, in SB 374.
I disagree with that
thank
interpretation, but we'll let the division deal
with
it.
I think we've heard the comments, and so if we could move on, is there another caller who would like to weigh in on the application process?
Yes, Marla. This is Max Del Real. I serve as a medical marijuana lobbyist and consultant. I want to first congratulate you and your staff for just an excellent and very thorough draft of the merit-based application process. I want to raise 2 points that are somewhat global issues in terms of where we go from here. First off, thank you for capturing in A3, Section A, number 3, the importance of knowledge and experience, compassionate use of medical marijuana. I spoke briefly about the idea that there is best practice models that exist today, not just in neighboring states, but throughout the country in terms of folks that are engaged today in the medical marijuana industry and have significant experience implementing the standard set that we are putting in place in Nevada. So thank you for that. My 2 points, one is a comment, the second is a question. My comment is many states, including Massachusetts today, have a 2-part application evaluation process, what we might call phase 1 and phase 2. I support this process as a way to essentially vet applications in a streamlined and efficient manner. What I'm saying is essentially creating a specific score in the first round, if you will, of the application process. My math says there's 100 points possible in this draft copy that your staff provided. I would encourage your department to consider a preliminary score or a mandatory score that applicants would have to get through to reach the, quote, second round, if you will, of the application process. That first round could happen very quickly. You would look at certain indicators of experience, security plans, business plans, what have you. That's my first comment. My second question, and I got to the call a little bit late, so I apologize, but I know this is a question that keeps coming up in discussions I'm having with different state representatives and even local folks. And I appreciate the comments about the idea of getting local buy-in specifically from the municipalities in Nevada. And I'm currently engaged with a number of city and county governments talking about local control of medical marijuana establishments, how these municipalities have to, in fact, create local ordinances, which is a complicated process in itself. My question is, and I apologize again if you've already addressed it, but can you talk briefly about an applicant who applies for both a dispensary, storefront dispensary, and a cultivation facility, having experience in both, and perhaps tying the two businesses together in terms of their ability to provide community support, community outreach, and a closed-loop system of what we call seed to sale? Can that happen, number one? And number two, will that positively affect their score?
Thank you, Mr. Del Real. In regard to your question about tying them together, I think it is very conceivable to tie them together. I think what we would have to say is, are you willing to, if one part, if you're not authorized to open a dispensary, then your entire application is voided, so we no longer consider your cultivator as well. I think that's going to be where we put the condition. We will accept it, but you have to accept that if they both are not going to move forward in the process for whatever reason, that the application itself is void, and then we move on to the next one. So I really looking for all of your input on that piece of it. And then can it get more points? Again, this is, we're here to get your input. So if collectively you all agree that that's the model you want to consider and it should have a higher point value, then I would say that you weigh in on that and you give us some suggested language to do that.
Marla, Marla, I
think it's our
appreciate
role
that comment.
to
I just want
Go
to
ahead.
quickly, and I appreciate that comment. I will be submitting feedback in writing, but here's my public comment. I would encourage the department to require separate applications. I believe the language is clear on that. So essentially, one applicant would have to apply two or apply two applications, one for the dispensary and one for the cultivation. You would have then essentially two applications, but they would be tied together by their business plan.
And under that scenario, if the business plan of one didn't get as many points as the business plan of somebody else, that is denied. And then since it's tied to the other, that other application is denied as well. I think that's what the clarification that we're looking for. When it gets to cost, and if the caller on the line could mute your line for a minute, we will be accepting, we will be charging fees for each separate application, even if they come forward jointly. I think the legislation says that we have to accept separate application fees, even if it's a joint application. So, you might have a $60,000 application versus a $30,000 for a dispensary and a cultivator. We wouldn't give you just the one $30,000 fee for both of those lines of business. So.
Marla, my last comment, this is Max Del Real again. I believe the applications can be judged separately because you will have essentially two different applications paying two different fees. I believe that the scores should be judged separately, but I also believe that additional points could be provided to the applicant because he or she shows that their business plan is filled with how can I say, greater knowledge or perhaps more knowledge in the entire process of what I call seed to sale of the medical marijuana.
Thank you. Okay, so we can move on to the next caller, please.
This is Rebecca again. I would like to just follow up on the seed to sale and offer an alternative approach that could satisfy the same intent that Max offered. And that would be, let's say that you had an applicant who is a cultivator, excuse me, and that's their specialty. And they're intending to provide product exclusively to 3 different dispensaries that are opening or who are also applying. And they, in all 4 of those applications, managed to demonstrate an appropriate seed to sale flow, then I don't think that those applicants should get any less points than an applicant who the same group of owners put in for the cultivation and the dispensary license, because as long as that seed to sale is being demonstrated well, then to me it just doesn't seem like there should be a preference given to whether or not it's the same applicant guaranteeing that or 2 separate applicants who have already agreed to partner and provide a robust business experience that way.
Thank you. Next caller, please. Anybody else on the phone wishing to comment about this morning's agenda?
Yes, this is Tom McFarland, Las Vegas.
Go ahead.
On the timeline, the way it's defined, you've got the review process for input from the public, and then you've got a separate comment in regards to posting on the property. Will those be running simultaneously?
So I believe at the point that we open up the request for qualifications, the intent is that it runs simultaneously with the review of that request. And then once that period closes, then the new period is just the different evaluation criteria.
Thank you.
Next caller, please.
Good morning, Marla. Steve Cottrell calling from AZ Med Testing. In regards to a conversation that was spoken a little bit earlier regarding the number of cannabinoids and medicinal information that is placed upon the package, the that's not a problem, but you're talking about some items that are very small that will be sold. Want to keep an eye on exactly how much information as far as cannabinoid levels, terpene levels are in fact printed onto the label due to the large cost of packaging and so forth. Most items, as far as flour goes, they can have a menu listing all of that type of information. My only concern is with some packaging being as small as it is, you won't be able to confidently put as much information as you need on it regarding some of the preservatives and the medicinal levels, the terpenoid levels, all of that. So you need to be cautious of how much information you are having to put onto the packaging regarding some of the medicinal levels or some of the requirements that are for medicinal levels on the packaging.
Thank you. Next caller, please. Anybody else on the phone wish to weigh in on the application evaluation process? Okay, well, we'll come down here to Las Vegas. I'd like to start with Dr. Udy, and then Mr. Gale is making me very nervous with his piles here in front of us. Go ahead, Dr. Udy.
Yes, I'm Dr. David Udy, and I have 2 points to make this morning. First of all, like it or not, it's clear that we're in the process of building an absolutely massive information system. And having experience in the last few years with the existing information system we have to just get patients enrolled, I'm really skeptical about our ability to pull this off. Just the discussions we've had this morning related to the laboratory passing on information of value to the dispensaries is a monumental task. We are right at the doorstep of having thousands of computer programs running on hundreds of different computers, and it is absolutely insane that we are missing this huge public health opportunity. The way that this thing is going now, there's going to be so much exchange of information that is confusing and out of character with anything else that's in the system. There really needs to be considerable effort made right from the very beginning. Unfortunately, this country doesn't have any research to build on. It doesn't have any background experience to build on. So everything we're doing is new, and we simply need to do a better job of integrating those systems and making sure that we can at least track what we're doing. It's going to be chaos the way we're doing this now. Trying to get all of these organizations enrolled in some process that we don't even know what it's going to be, and it doesn't exist yet. There has to be some people from the regulatory end of this that will grab hold of this and start to build things. We've presented a list of definitions. Definitions are 20, 30 years old. We need a data dictionary. We need components of this system. We need requirements from each entity as to what they're going to produce confidentially and what they're going to produce for general consumption in this state. If we're going to begin this effectively and make it better, we have to concentrate on this massive information systems problem. The second issue that I have today is, before I get into that, I should note that I have spent over 3 years as the chairman of the Economic Development Committee for the NAACP. You might note that I'm a white guy. I've spent most of my professional career dealing with disadvantaged and disabled people. I understand the situation with the dispensaries. I understand the requirements for the laboratories. But when you come to cultivation, this is absolutely, by any definition, an issue of discrimination. You are forcing this into just people who have $250,000 to sit on. These people, by the definition of the people that I work with, have already got it made. If they aren't living a good life with $250,000 in the bank, they're idiots. The people that I deal with have a problem of dealing with it every single day. If I'm a disabled veteran out there and I want to grow 20 plants, 30 plants so that I can take care of my medication without spending the $400 going to a dispensary, and I want to have maybe a little bit extra money to put towards the electricity bill that I have, that has to be applicable. If it's not, it's discrimination. What's going on in this country right now has got the people that I represent mad as hell, and they're not going to take it anymore. If you don't think that the media will pay attention to the discrimination issues here, you're absolutely wrong. I'm sorry to bring this to you personally because I like what you're doing and you're doing a great job. And I have no problem with the regulations you laid out and the compliance for the grow facilities and all of those other things. But by not letting these people in the game, there's a complete problem here. If you don't think I can fill this room with 100 people in wheelchairs, you're wrong. If you don't think I can fill this room with 100 poor people, you're wrong. If you don't think that there's people out there that want to get in this game and will recognize that they are clearly being discriminated against by any definition of the word, you're wrong. If you could see what the opportunities would be for these disabled vets, this is a remarkable chance for them to do things. Understand, fighting with white flies and spider mites might not be the same challenge that you have fighting with a bunch of crazy Afghanis, but these guys can deal with it. They should be allowed to participate. What you're doing is absolutely wrong, and it can be stopped. I like this program. I want to see it move forward, but this is an absolute injustice. I'm sorry to bring this forward because everybody in the back of the room that already has their $250,000 wants to hit me in the head with a shoe. I understand that. But there's a bigger issue here. The very people that this program was started for are the first people that you are excluding from the process. It's absolutely wrong. It's absolutely wrong at every level.
Dr. Udy, I'm not disagreeing with you and what you're saying. However, the bill is pretty clear what our limitations are.
Understand, I've worked with the governor's committee on assisted living. I know how this world works. I know we're just looking for a simple exception that says you need a doctor's letter that says this will be good therapy for you, and the ability to produce your own medicine is a good thing, and it can be accepted, and there's just one line that just needs to be signed. Don't make these people think this is a huge bureaucratic thing and a legal problem that can't be dealt with. Look at what's happening in Washington as I'm sitting here. This is ridiculous.
I appreciate your perspective.
I'm sorry, I'm upset, but this should not go forward until this is addressed. It's discrimination.
You've made your point. Thank you. I appreciate you making your point. Mr. Gale?
Good morning, Marla. I'll be very brief. First of all, I want to thank you and your staff again for such a great job y'all are doing. I have 3 points. My first point regards Senate Bill 374, Section 11.7, subsection 9. As you well know, Section 11.7 reads, in determining whether to issue a medical marijuana establishment registration certificate pursuant to Section 10 of this Act, the division shall, in addition to the factors set forth in that section, consider the following criteria of merit. Number 9, the amount of taxes paid to or other beneficial financial contributions made to the state of Nevada or its political subdivisions by the applicant or the persons who were proposed to be owners, officers, or board members of the proposed medical marijuana establishment. And the handout today, where the division has its where it evaluates and scores applications, there's nowhere in Section A1 or Section A, quality of proposed team, specifically Section A1, owners, officers, and board members, Section A3, operational team, Section F, which is financial resources, Section G, business and marketing plan, or any place else where you take into consideration Senate Bill 374, Section 11.7, subsection 9. So I wanted to just draw that to your attention. That's my first point.
Mr. Gill, I think the handout replaces in the smaller handout that's specific for today, replaces lines 96 through 97. So the other provisions in the larger document right now are still moving forward as it relates to the application process. So those are also open for comment and discussion today.
Okay. Then I stand corrected because it is in subsection 2 of 97. I thought this was supplanting or replacing what was in the larger handout. So based on that, I guess I'm mistaken.
It's just replacing lines 96 through 97. So if the old 97 had language that didn't get carried forward, then we did intentionally take it out. So your comment is warranted.
Okay.
So thank you.
Thank you. My second comment is pertaining to Senate Bill 374, Section 3, subsection A, little 2, and then Roman numeral 4. And that's the provision that deals with the owner of any owner or any applicant for a proposed medical marijuana establishment either own the real property or have permission from the owner to operate the proposed medical marijuana establishment. I didn't mention this either Friday or Monday, but I thought it'd be appropriate to raise it today. And I don't want to make things more complicated than they are, but my concern is, and my comment is, that I don't know if this division has considered in the application considering or allowing an applicant to propose more than one location. My concern is that an applicant might meet all the requirements of Section 11.7 and Section 10 of Senate Bill 374. They might meet all the other requirements of this division's regulations, and the application is stellar, except that I wouldn't want the applicant's application to be rejected because even though it complied and the location met the statutory requirements of SB 374 that was in a commercial industrial zone or overlay, that for some reason the Division of Health had a problem with the location, even though they got the provisional approval from the local jurisdiction, that the application would be denied based on that. Second, as a collateral concern, there's also, as you well know, some local jurisdictions in Clark County and I think Lyon County that, potentially may not be too amenable at this point to medical marijuana in their jurisdictions. Specifically, say Las Vegas, as you well know, they have a 180-day moratorium where they will consider any applications, and that can create a potential a bottleneck for when the Division of Health might be accepting their applications. Despite my objections, I did not prevail on that issue in the city. So I'm concerned that I pose whether there could be multiple, maybe let's say three proposed locations in an application instead of just one. And I use that number because I don't think three is excessively large, but I'm concerned about it being limited to one.
Thank you, Mr. Gale. I think I don't think we're going to have any limitation on the number of locations. You're going to still have to get the approval from the local government and from the owner and the local government to demonstrate that those are appropriate locations. I think the division denying an application because we don't like the location, I don't think that we're intending to have that as part of our criteria. We're just looking to make sure that you've got that local government authority for that location. We're not going to judge it otherwise. So we will make sure that what we write says we aren't going to judge your location, but it has to have that approval from that local government, or that some level of authorization that that's an acceptable location. So it's not going to be a criteria that we weigh in on, I guess is what I'm trying to say.
Okay. Thank you. And my final comment is, this was mentioned earlier today by the first speaker, and it was discussed briefly, I don't know if it was either on Monday or Friday, and that's the requirement of audited financial statements. Before I was an attorney, I was a certified public accountant here in town, and I'm somewhat concerned about the requirement of audited financial statements, and I could certainly, address that later, or I would like that to be a topic of discussion. And again, I'm looking for the specific provision, and I don't know if we were going to require audited financial statements for the applicant, every potential owner, shareholder, member, depending on the form of the entity, partner, and obviously, I think maybe the state or the Division of Health wants something more than just a compiled a compilation, which is just prepared by the applicant, and there's nothing done by a CPA, as opposed to maybe a review, which is a little bit more, but significantly less procedures and cost than an audit. Anyway, that's it for me.
Okay, if I could respond, I think there are two issues related to financials. One is you have to be able to demonstrate you meet the $250,000, which is the base. And that is just a straight up show us what you've got and make sure, and that we can verify that it's accurate. The other is the issue of diversion and finances as it relates to potential diversion. I think that is on our agenda, and it's something that we need to, I think, do due diligence to and make sure that we can ensure, I think, officials in the state of Nevada, that we're able to identify where there could be possible diversion through financial statements. I think that's the other piece that we're looking to build on.
Okay. Thank you.
If I could also say something about location. What was I going to say? I can't remember. Hopefully it'll come to me soon.
Thank you.
Go ahead, Mr. Higgins.